So I'm going to begin the first part of our presentation today, providing an overview on racialization, employment, and income in Canada. And so I think we all know that racism is a structural determinant of health. And if we're talking about health equity, we're trying to imagine a world where we all have equitable opportunities, and I would argue equitable outcomes in terms of our health, which are rooted in the conditions of everyday life. Recently, so late last year, the Pan American Health Organization released a report where they talked about health inequalities in the Americas. And so the framework you see on your screen is from that report. One of the things I like about this report, this is work which is coming about 10 years after the World Health Organization Commission on the Social Determinants of Health. And in this work, the PAHO was really trying to bring greater attention to racism and colonialism as drivers of inequality. And I think that has been one of the real big critiques of some of their earlier work. And this framework really points to the fact that if we're concerned about shifting conditions of daily life, so things like income, early life, we really need to start looking at the structural drivers of this. So what actually shapes the distribution of those social determinants of health? In this framework, they actually brought closer attention to intersectionality. I just want to highlight that because today we'll be talking primarily about race as our entry point. But I think we need to keep in mind that for different racialized peoples, people navigate life around different intersections, and so you're often dealing with different systems of power and privilege in your life. So I think that's a really important thing to keep in mind as we do this work. So just employment equity, I think if we're thinking about creating equitable organizations in public health, we need to think about employment equity in a couple of different ways. So really, one is numerical representation. So thinking about the extent to which your organizations reflect the communities you live in, and you can use numbers to do so. And then really also focusing on the institutional environment. So what happens within organizations? What policies and practices are in place to ensure that racialized and indigenous folks actually have positive experiences which are free from racism. And so just as a reminder, right now about more than 1 in 5 Canadians are actually racialized. And racialized peoples are quite diverse. And again, today we're not going to be talking about population-specific initiatives, but really providing a broad picture of the kinds of things organizations can do. But from an implementation perspective, I think it'll be important to look at how different organizational policies and practices are tailored for different racialized people, because people are racialized differently, which means that racism shows up in very distinct and different ways in people's lives. So that's an important thing to think about. The racialized peoples are quite diverse, as I mentioned. South Asians are currently the largest group at about 25%, and you can see that you can see the breakdown there. I think there's been some positive activity in the public health space. I just wanted to share a few pieces of work that's been happening. So colleagues at the Well Living House, Dr. Janet Sloan and her team have been a lot of work trying to bring work on anti-Indigenous racism to the forefront. So I'll encourage you to check out that work, as well as work from our colleagues at the National Collaborating Center for Indigenous Health. So as I mentioned earlier, we know that racism is a structural determinant of health, and it drives racialized inequity. So racism really functions both through our structures and through our culture. So I think we need to pay attention to both the cultural dimensions, the structural dimensions of racism. So in a cultural sense, we can think about the kinds of narratives, stereotypes, values, and cultural images which we traffic in, which really reinforce some very harmful stereotypes, and how those show up in our workplace. And in terms of the structures, we're really thinking about the institutional practices which show up in the health sector, but also beyond. So other public policies which extend beyond public health. So in our case today, we're thinking about, say, employment equity legislation at the federal level as a good example of that. So what happens at the intersections of racialization and employment? So we know that in terms of workplace of labor participation, racialized folks participate at a slightly higher rate than white folks do. And you can see here that participation is at about 66.5% compared to 64%. So there's pretty high level of labor market participation. And then when we look at employment rates, we see again that employment rates are, they vary for racialized men. Racialized men are more likely to participate in employment at 65%, compared to white men at 63%. And when we start to look at unemployment, that's when we start to see some really, what I'd say are some really concerning trends. So we can see here that unemployment rates for racialized women are at 9.6%. And when you compare that to white women at 6.4%, you see a significant gap. And so we have, this analysis has been done for the Ontario context by the Canadian Centre for Policy Alternatives, and we'll share the link to the Ontario report. But StatsCan has data on this, which if you want to look at what this looks like in, say, your province, and maybe even your city, you may be able to find, get a picture of what this looks like in your own community. So I think it shows some very troubling trends. So we can see by these numbers that unemployment is highly racialized and it's highly gendered. So with racialized women having some of the highest unemployment rates. So just taking a closer look at what this looks like for different racialized people, I just wanted to highlight a few pieces. So I think a lot of us are familiar with this idea of the gender wage gap, and I think that idea has really been taken up in very public ways. And I think we need to actually have a more nuanced approach when we talk about the wage gap and really think about how it impacts communities differently. When we look at this, we can see that the gap for racialized women is 0.96. So that means for every dollar a white man earns, racialized women earn 59 cents. And again, that's just for different racialized people. I just highlighted there that for Arab women, that is actually half of what a white man earns in Canada. And for black men, it's about 66 cents for every dollar. So this kind of analysis really starts to show us that racialized peoples are affected across the board. I think that's fairly consistent, and are impacted in very distinct ways. I think one of the popular things in the Canadian imagination is this idea about the role immigration plays in employment experiences and in income and earning potential. So this idea that over time we will see inequities disappear because people would have assimilated into Canadian culture, and when we look at the data, we can see that does not hold true. That even after many generations in Canada, racialized inequities still persist, and we can also see that for racialized and non-racialized immigrants, you also have significant inequities in income. And again, when we look at this for different racialized groups, we can see there's a different, of a nuanced picture. So over time, some racialized people actually reach the white average or exceed it. So that happened for a few communities. But for many, many communities, we see that inequality persists. And so we can see that for Black Canadians, for example, over multiple generations, the earning stays pretty standard. And also, I'd say the composition of racialized people actually changes over time. So while South Asians are the largest racialized group in Canada, by the time you get to third-generation Canadians, you see a higher proportion of Black Canadians and a higher proportion of Japanese Canadians represented in that group. So I think this really shows us that immigration alone does not account for the inequities we see, and that we really need to be taking a hard look at how racism shows up in our everyday policies and practices. There's been some promising work linking experiences of discrimination to health data. So in the 2013 Canadian Community Health Survey, there was a rapid response module which was included, which had questions around experiences of discrimination based on race, gender, age, and a couple of others. And so this work was some analysis was done earlier this year by the Wellesley and some colleagues there, and this shows you that racial discrimination is quite high for racialized and Indigenous folks. So you can see here that about 2% of white people completing the survey said they had experienced discrimination based on race. And you see that for Black folks, it's at 30%. And so these, I think, are very concerning numbers. And in other surveys which have been done, not necessarily linking health data, we see experience of everyday discrimination as high as 80% in some cases. So I think experiences of everyday discrimination are a concern and have implications for health outcomes. At the institutional level, so really think about what happens within the walls of an organization. There are various things which you need to keep in mind. So racism can be produced through the recruitment and hiring process. We also know that racialized and indigenous folks have less access to management training programs, which help build their capacity to advance into leadership positions. And we see that racialized and indigenous folks are less likely to be represented in senior decision-making positions. And this holds true across most sectors. It holds true across regions. I think for organizations who are also sometimes trying to comply with what the client of community's preference, that can actually lead to some really discriminatory placements. So we hear stories of the clients refusing to work with racialized staff. And so when institutions acquiesce to those discriminatory practices, they actually do help increase inequities. We also see consistent pay inequities in terms of compensation and earning, and we saw some of those in the data I just presented, as well as high levels of what I call racialized abuse, harassment, and everyday racism in the workplace. Racialized folks are also less likely to have access to the professional networks and the social capital, which then helps in career advancement. I think what keeps all of this in place is the fact that norms of whiteness and Eurocentric ways of being is what is still being privileged in most of our workplaces across the country, again, across sectors. So this is some quotes from nurses who were interviewed about their experience of racism within health settings. So one of them said, "We know that women are more likely to be victims of violence, and nursing being a female profession, if there's a risk of violence, the racialized nurse or health professional will more likely be a target than someone who is not and who is in a position of power." Another person shared, "Racialized nurses experience aggravated forms of harassment, report experiencing a variety of mental health symptoms, physical symptoms, withdrawal from the workplace. There is a connection between harassment and illness." And we're starting to see a lot of research being done, documents the experiences racialized and indigenous people are having in the workplace, in the health space. And I think what that shows, again, consistently is that for a lot of folks, institutions are a site in which racism and dominance just keeps getting reproduced, where the knowledge and skill they bring to the job is not always valued. They're exposed to high rates of harassment and everyday racism. I think leadership is an important thing to consider if we think about what happens within organizations. This is work coming out of Ryerson University, and Ryerson University has a diversity institute, which has been doing a lot of work in different sectors looking at the experiences of women and racialized people within organizations. So this is data coming out of Montreal, where they looked at the representation of racialized people in senior leadership positions across a number of sectors. We can see here that about 23% of Montrealers are racialized, and when you look at who is leading organizations, you have only a 5% representation. They also found some variation across sectors, so you can see here, and if you look at the 2019 data, which is the pinkish bar, we can see here that in the public sector, which is what public health will fall, that representation was at 2.2%. The hospital sector was a little bit higher, 5%, but I think these are, again, we're seeing very low levels of representation across various sectors. There are currently, I'd say, policy levers which we can look to. A lot of the times we talk about the fact that there is employment equity legislation at the federal level. Now, I think that's it's often cited as a really good policy and practice, which I think it is, but it covers a very small percentage of the population. And it's been around since the 1980s, and we're seeing that it hasn't yet lived up to its full potential. In 2017, there were only 561 employees who actually reported back to the government about what they were doing, which covers only 3% of the population. I think there's potential to expand that, expand employment equity legislation into other sectors and actually put some teeth to this and not just let it be nice to do things for organizations. We also know that racialized folks are more represented in low-wage jobs. So I think legislation around minimum wage and really moving that conversation around ideas of a living wage and a thriving wage will actually have some impact in reducing some of the inequities we see in terms of income. And in the absence of this, individual organizations can actually implement this on their own, which we're seeing some organizations just taking this up through in different ways. So I'm hoping this provides us with an overview of what this looks like in the Canadian context. And so I'd like to know from you, given the experiences you have, what's going on in your own workplace, what do you see as the biggest opportunity to improve racial equity in employment and income? And so I'll just look at the chat to see what people are sharing. So what are you seeing as some of those opportunities? So as the responses are coming in, what I'm sort of observing is, one, these conversations are not new. They've been happening for a very long time, and with organizations trying to respond to the Truth and Reconciliation Commission recommendations, I know of a few organizations who now have recruitment programs which are focused on Indigenous people. But I think those are really promising examples of how organizations can really take a very deliberate and concerted effort to improve racial equity in employment. So thanks for those responses. Someone is sharing, Harmony is sharing that she can see an opportunity for more diversity in leadership positions. Jill is saying being open to multiple ways of knowing. Sanjay was talking about diversity in leadership, great. Catherine says we can address harassment in general. Marla says we can adopt employment and income strategies in our workplaces as leadership as well as strategic priorities. Great, thank you. I think we can see that there's lots of opportunities to actually move forward with this work at the federal level. The federal government did pass an anti-racism, release the anti-racism strategy. So these are all, I think, things which we can hook our work on. And again, this is not new work. We need to, around this strategy, I think there needs to be some significant accountability, because what we see sometimes is organizations really invest in creating the policies and having the strategies, and you have the nice big reveal. So it's almost like a bit of a PR strategy. And when it comes to implementation, we start to see those gaps in implementation. So really, I think following through from developing the strategies and implementing practices to the implementation. Great, so thank you for all those suggestions. Those are really great ideas.